My name is Tim Salt, born in England in 1952. My first hobby is recreational mathematics. I've had 12 books published. They've sold 750,000 copies. And my other hobby is cycling. And my wife and I, between 2015 and 2019, cycled through 40 different countries, 30,000 kilometres on various cycling trips. And during that, they discovered I had first stage of prostate cancer. So very, very early. I was having radiation treatment for that. They did a number of other tests which showed I was high in the immunoglobulin G. So it was early stage multiple myeloma known as NGUS. So again, unlucky to have it.
He's a very senior patient, over 70 years old, diagnosed with active myeloma for 3 years, with the past history of 6 years MGUS and smoldering myeloma. And he had the translocation of T4 and 14, and also 1Q positive and TP53 deletion. So he's basically a high-risk myeloma patient, relapsed after first line of BCD, and then he cannot tolerate the side effect of maintenance, and his life quality was very poor before the treatment.
And that time, because you read about what you can on Google and so forth, I knew that CAR-T was my best hope. So I talked to my haematologist and said to him, I'd like to do CAR-T. And his answer was, well, I've read about it, and yes, I'm very interested, but it's not something that's available in New Zealand. So I have no practical experience, but I'll find out what I can.
CAR-T cell therapy is a precise and innovative process. Utilizes the patient's own immune cells, which are genetically modified to enhance their anti-tumor capacities. As we know from the previous clinical trial data and our experience, BCMA CAR-T is the best choice for relapsed multiple myeloma, especially for high-risk population. Not only for the best efficacy, it has long-lasting efficacy for 12 months PFS over 85%. CAR-T cell treatment not only focus on pathological improvements, but also prioritize enhancing the patient quality of life. One short infusion can help the patient have very long time progress-free survival and overall survival.
So then the question was, well, when can I get CAR-T? It's not available in New Zealand, not available in Australia, super expensive in the States, and only available to people that really have very few other options. And only recently has this been available in the States for people that have had just one line of treatment. Up until just a few months ago, you needed to have had 4 lines of treatment. So I wasn't eligible. And that applied in other countries as well, but there's not many countries that offer CAR-T.
China is a global leader in the development and application of CAR-T cell therapy. We have advanced technology, a robust production system, and extensive clinical experience and experts. Our strength not only lies in the innovation, but also in our ability to offer effective and affordable treatment solutions to patients worldwide. More and more international patients are coming to China for CAR-T cell therapy, recognizing the high level of care and innovation we provided.
China has a lot of experienced doctors in this field, so the effectiveness, obviously, it's important. To initiate CAR-T therapy, we need to have a good team, which is a multidisciplinary team, including hematology, also oncology, and Sino-United Health. Our mission is to solve patients' problems through holistic clinical practice, the CAR-T therapy. So this is one of the strategies of our hospital development. We have the ability to do that.
So I was kind of lucky. I'd come across another multiple myeloma patient in New Zealand on a Facebook page that said, well, I've heard about this in Shanghai. She gave me the contact details for Dr. Lily Zhou. She was fabulous, really helpful. The treatment, well, I know it's got a statistically a very good rate of recovery, and I'm ready to give it a go. That's new treatment. So I came here because really it was my only option.
This patient is high-risk relapsed myeloma. Most likely, the overall survival and PFS will be decreased during the previous standard treatment. So, based on the efficacy and the safety, humanized CAR T-cell treatment will be the best option for this patient. First of all, we need to evaluate the patient's situation, then collect the patient T-cells, genetically modify them in the lab to enhance their ability to recognize and kill cancer cells. Once modified and manufactured, the T-cells will be reinfused back to the patient, and then they will target the cancer cells. Throughout the whole process, to ensure patient safety, we closely monitor them throughout the whole treatment and adjust the plan as needed based on their response. With thorough risk assessment and personalized management strategies, we can effectively control these side effects and make sure the patient's safety navigates each phase of the treatment.
I found the treatment here, especially compared to the stem cell transfer, very, very easy. So instead of a 6-month recovery, it's a 5-day recovery, and it's all very easy. Very little, but low-grade fever for 5 days. Touch of diarrhea, a bit sleepy for 2 days, but it doesn't seem to have affected me at all. They tell me all sorts of good things are happening in my body, as they should, and it is working. No fears, no worries, go into it, and it's all been fine. Definitely benefited from having this treatment while I was well, and that's the magic of CAR T.
For this patient, we are very happy to see there's only grade 1 cytokine release syndrome, and that also fits our experience before. And the patient was quite safe, only have high fever without other side effects. The most common side effect of CAR T-cell therapy is cytokine release syndrome, which we call CRS, and neurotoxicity, which is luckily in BCMA humanized CAR T, we randomly see severe side effects, such as grade 3, neurotoxicity is less than 5%. And for CRS, it's very common, but most of them are grade 1, grade 2, so which is mild and tolerable. Post-treatment tests show that the tumor has been well controlled, serum-free light chain almost back to normal. Key indicators have significantly improved, and the patient's overall health has gotten much better. The results have fully met, if not exceeded, our expectations showcased that the outstanding effectiveness of CAR T-cell therapy in treatment of complicated lung cancers. And 2 weeks post-infusion, he was discharged from the hospital and back to his hometown. We're happy to receive the patient email yesterday. He told us he started to walk his dog and he already feels much better after the CAR T treatment. The success of this treatment is due to our multidisciplinary team's expertise and collaborations. Our team has extensive experience with CAR T-cell therapy, which allows us to design personalized treatment plans for each patient and make timely adjustments during the process.
All the team members here, we are trying to help our patients. Like I said, mentioned, from infection control to the ICU care, to the specialty care, hematology, and it's a system, and quality safety system. And also we need to assure patient has very good patient experience. We have the advanced platform here for patients, like all these devices and facility, the cutting edge. So patients, they really enjoy the environment and all this new technology. Then they say, oh, this is one of the best hospitals I have ever been.
I have been working in hematology area for more than 20 years. With witness of the successful result of CAR-T, I'm very happy for my patient to get this really leading technology. After so many years seeing the patient losing the hope, while after CAR-T, they gain the better response and complete remission and go back to normal life. That's really not only privilege, but also blessing. Not only for the patient, but also for the doctor. We are looking forward to help more patients all around the world. Hopefully, we can bring the new hope to all the blood cancer patients with this leading technology, including CAR-T.
I'm happy about that. Just feeling good, but I never expected to feel otherwise. You know, life is good. So yeah, I'm feeling happy. The nurses have been great. We just live in a wonderful world. So I'm just grateful I'm alive at the time I'm at. But yes, special thanks to the nurses, the manufacturers for Casso and the doctors. One of my favourite quotes from John Lennon, and it appears in a movie called The Exotic Marigold Hotel at the end. And the line is, everything will be okay in the end. And if it's not okay, it's not the end.